Hi, so I'm at the ASCO 2019 meeting, and we've been going through the past several days looking at several of the research and advances that have happened in all cancers, and particularly in acute myeloid leukemia. As you know, there's been significant improvement in many of the therapies that we have in AML with the discovery and recent approval of drugs like venetoclax and IDH1 and IDH2 inhibitors, as well as new FLT3 inhibitors. So clearly our outcomes are improving, our therapies are improving, we have more tools in the toolbox, but there are several challenges that still remain. And I think some of the biggest challenges include those patients who have secondary AML, that is to say those patients who have had prior myelodysplastic syndrome or aplastic anemia or myeloproliferative neoplasms and then transform to acute myeloid leukemia. These patients often have a much more adverse prognosis, not only because of their prior underlying disorder, but also highlighted by the fact that many of these have adverse karyotype, bad chromosomes, adverse mutations, and are resistant to standard chemotherapy, and even resistant to some of the newer therapies that we have available for them. A particularly difficult subset among those are patients who've had prior MDS and who are treated for their MDS with hypomethylating agents, for example, and then progress to AML. So although they're considered newly diagnosed AML, they actually are a much more difficult subgroup that act more like relapsed and refractory AML. So that's one of the major challenges. I think there's a lot of research and a lot of groups that are looking into that subset and trying to understand what is different about those patients compared to de novo patients and how we can treat them a little bit differently. Sometimes we get lucky and they may have mutations like FLT3 or IDH1 or IDH2 and may be sensitive to the respective inhibitors, either alone or in combination with some chemotherapy, but challenges still remain. I think another challenge is those patients who have P53 mutations, often seen in patients who have therapy-related MDS or AML. These are patients who have received chemotherapy or radiation therapy for other cancers, and then subsequently later in life develop AML. And the P53 mutations we know don't respond well to chemotherapy. There was some data recently suggesting that a 10-day course of the hypomethylating agent decitabine was active in this subset, so it improved outcomes, but still a lot of work needs to be done. There are some newer molecules called APR and others which are looking into this subgroup of patients, which needs more attention and certainly represents one of our biggest challenges. So although we have got a lot of new improvements, I think we've done a great job, and we're really excited to be treating AML patients with these new drugs. There's still a lot of work to be done and challenges that remain.